Good morning. We at DP Medical have developed a range of shields, protective shields for use with the global microscope. They will fit all models of microscope. This has become necessary obviously due to COVID, but we feel that it also provides additional protection for other airborne spray and any contaminants. The system consists of a number of components, the first of which is a horizontal spray shield. They're all manufactured in Perspex. This is a 1mm slightly flexible horizontal spray shield which attaches to the objective lens on the microscope. To fit it, you simply unscrew the lens, taking care not to drop it, place the lens through a 60mm diameter hole and reattach it by screwing it into the microscope body like that. We recommend that you have at least 2 complete rotations to provide secure fixation. That is now attached to the microscope horizontal shield. You may find that when you do that, or when you place the shield initially, that the handles obstruct the shield, in which case you just need to rotate the handles to a position where they don't obstruct the shield. So that now provides protection from rising spray. It can be positioned across the patient. It can be positioned at any angle you wish. However, we recommend maximum protection in that position. The second component is a visor for the operator. As you're aware that face-mounted visors make it difficult to use the microscope as it forces the eyes too far away from the optics. So we've developed a visor system for use with the global microscopes. This consists of 2 components. A vertical visor made of 4mm Perspex, which slides on from right to left behind the binocular, like that. The second component is a horizontal visor made of 1mm Perspex, which slides on behind the vertical visor and provides protection from either side. So with the visor mounted on the binocular, you now have top, bottom and side protection. Again, you can still reach all the controls on the microscope. It does not obscure the controls. So the combination of these components plus the use of a conventional face mask and of course rubber dam will provide a high level of protection. The other product we have developed is for use with a binocular assistance scope. Some microscopes, some users use a binocular assistance scope which will also need a visor to protect it. To attach it, you simply remove the binocular head by undoing a hexagonal screw here, or some of them have an Allen key to undo the screw there. Remove the binocular head, place the assistance visor onto the assistance scope, which has an interface like this with a locating screw. Place the locating screw through the small hole in the visor and reattach the binocular head, taking care to make sure that it's tightened correctly and seated properly onto the assistance scope. And you will find that the visor is positioned between the binocular and the assistance scope. This needs careful attachment to make sure it's securely attached. So now the assistant has a visor for protection from above and below, and that in conjunction with the horizontal visor provides a good level of protection. Different microscopes over the years have got slightly different configurations of binocular head. We have a product to suit everyone. The horizontal shield is universal to all microscopes. The assistant scope shield is universal to all microscopes. However, on the binocular heads they do vary. If you have a fixed, this is an inclinable head, if you have a fixed inclined binocular head, you can still use the visor. It attaches like that from right to left, fits on there, and then the horizontal visor, in the same way, it slides down at the back to provide protection. However, when ordering, it is important that you send a photograph of the binocular head taken from the side to ensure that we supply the correct item. There are another few variations which you will find on the microscopes. For example, this is an old G-series microscope. These handles will actually get in the way of the horizontal shield. So to fit the horizontal spray shield to that microscope, we do it slightly differently. Remove this. So to remove the horizontal shield, unscrew the lens, taking care not to drop it. It's easily done. On the older style microscope, such as this one, which is a G-series microscope, you will find that the handle obstructs the horizontal shield. So what we need to do here is just remove the bottom of the lens like this. Again, taking care not to let the glass drop out, which it will if you're not careful. Remove that bottom screw, attach the horizontal shield there, and then reattach the screw there. If you're not careful, this lens will drop out, so you have to pay particular attention to doing this correctly. You now have your horizontal shield on an older style microscope. The fitting for all lenses is the same. This is the original from many years ago. This is a multifocal lens. The thread's the same size on all of them. When ordering, as I say, it is important to send us a picture from the side so that we can supply the correct item. If you have any questions related to these products, which, although reusable, we recommend that they're replaced after 25 uses, because perspex will eventually deteriorate. It can become a little opaque. It can appear scratched or smeared, and we believe it's important that you have good presentation to the patient, and of course it guarantees good function for the shields. So we sell a set of shields, which are the horizontal shield, the vertical horizontal spray shield, the vertical visor and the horizontal visor, for £125, which over 25 uses works out at approximately £5 a patient. They can be reused, and to disinfect them, you need a 0.5 to 1% sodium hypochlorite spray. Spray the shields, leave for 5 minutes, wash, dry, and then reuse. In view of the disinfection procedure between patients, we recommend an initial purchase of 2 sets of shields so that one can be recycled whilst you're working with the next patient. If you have any specific questions, please feel free to call us, and either I or one of our technical staff will be very happy to advise.